Okay, so the topic I decided to do was dementia, and in this picture, it's my grandma and grandpa, and me, my sister, and my brother. And my grandma actually has dementia. I'm not quite sure how long she's had it for. I think it's been at least 3 to 5 years. It's been a while, but so I just thought this was funny with old age and not necessarily dementia even. I won't say my memory's bad, but it's not to the point now that I can, it's now to the point that I can hide my own Easter eggs. Um, okay, so the definition and characteristics of dementia. The Mayo Clinic said that dementia isn't a specific disease, but it actually describes a group of symptoms that affect memory, thinking, and social abilities. There are both cognitive and psychological changes with this disease. Um, Cognitive changes are memory loss, difficulties communicating, completing tasks. Psychological changes are personality change, agitation, hallucinations, and inappropriate behavior. I actually work in a nursing home. I've been a CNA for like 3 or 4 years now, and the hallucinations, like when I walk into a elder's room and because they're almost getting out of bed and they're saying they hear like they saw like a child or like a man standing at the edge of the bed, like honestly that literally gives me chills. It's terrifying. um, so just because an individual is experiencing memory loss doesn't mean that they have dementia, because this also just comes along with old age. Um, Dementia does affect people differently based on the part of the brain that the nerve cells are damaged in. It cannot be, um, well, no, it can be reversible, but as it progresses over time, it is irreversible. And some examples of basic activities that people with dementia may have problems with are eating, bathing themselves, cleaning. Sometimes it gets really bad to the point where they can't even get out of a chair. They can't take their own medications. They need people to help them with that. And a lot of times they end up being unable to drive because they get lost or, yeah. Okay. So, the most prominent patterns of mental decline that are associated with aging are delayed thinking, problem solving, decreased attention slash concentration, and slower recall. Normal memory changes versus dementia symptoms are similar, but there are some clues that can differentiate the two. So, a normal aging person may complain about memory loss, but they can provide details of forgetfulness, and they may pause to remember directions, but they don't lose track of where they are, and they can still remember very specific events. It's not like they don't remember like last week or something. And in this picture, again, my grandma and grandpa, and then that's me and my other little cousin. Um, so for um, well, as people age, there's memory loss that takes place, but with dementia, there are a lot of other abilities that are also affected as well. So with a dementia patient, they may complain of memory loss, but this only happens when they are asked to recall something and they can't. They may search for words and pause, but instead of actually finding the word, they'll just put some other word that sounds like it in its place. They get lost in places they are very familiar with. Just honestly, it could be, I know where I like work again, residents don't even know that this is like their own room. Like they just don't know where they are. They don't understand. They continually ask like, how do I get home? I just want to go home. Can you help me? It's really sad, actually. I feel super bad having to be like, oh, this is your home. You're here. But yeah. Other things are loss in interest in social activities. At my work, we actually have like people come in and bands and I don't know, like musical instruments. And as you get to know your like individuals or the elders that you're working with, you understand what they like and you know about their past and what they did for fun. And so it's really easy to engage them when you understand what they like. And I don't know, that just comes with over time as you are with them. You know how they'll react to certain situations and such, I guess. But symptoms of dementia can vary among each individual, just it depends. So, the Alzheimer's Association states that from the following list, at least two of the core mental functions must be significantly impaired to be considered dementia. Multiple symptoms of this, they start out slow and then gradually get worse over a period of time. So the core mental functions are memory, communication and language, ability to focus and pay attention, reasoning, judgment, and visual perception. And then in this picture is a bunch of my family. Weird thing is I barely remember this picture. I think I was at my cabin and we were all biking around, I guess. I don't know. Okay, so although most forms of dementia cannot be cured, doctors have found drugs that help reduce or slow down the development of the dementia symptoms. So the two drug treatments are choline esterase inhibitor, which increases the levels of chemical messengers involved in memory and judgment. And then the other one is mamitine, which regulates the activity of glutamate because glutamate is a chemical messenger that is involved in brain functions such as learning and memory. A patient that has dementia can be also prescribed other medications, like ones that have to deal with sleep disorders as well, because dementia can mess with that. We had a lady that she was fully mobile and she would just run around like trying to escape out of the willows is what they called it, and it was basically all a memory care area. And we let her stay up with us as long as we could, and then eventually we would give her a sleep aid. But I don't know, she wasn't that bad if you just had her sit down and talk with her. So this is the choline esterase inhibitor, just a bigger picture of the postsynaptic membrane and how the neurotransmitters cross and such. And then this is the memantine picture of just how it works. Oops, sorry, I went that really fast. So non-drug treatments for dementia are occupational therapists that can help teach the individuals how to deal with the behaviors, and they help them teach them ways to adapt and activities that they can do as the condition gets worse over time. And then as a care provider, we can help them by modifying the environment by our response and tasks. So by modifying the environment, this is like reducing clutter and distractions and confusion. I know that if I'm talking to an individual with dementia and someone across the room is screaming and the TV's really loud, like chances are they won't understand what's going on and they'll be very distracted. And there's actually like people with dementia, like their vision kind of goes circular, and so like they can't even see like fully. It's like sometimes they run into things, and yeah. So we can help them a lot by just changing the environment so they're not as distracted. Our responses also can help because an example of this would be if I'm trying to ask an individual like what they ate or something and they said they haven't eaten, they don't know, and I push the subject like, no, we just ate like 10 minutes ago. That's a horrible way to go about a situation. It's going to make them really upset, and for me, I would be very uncomfortable. I would never do that. And then when it comes to tasks, it's important to give them steps and kind of make it easy and focus on like one step at a time. I know this can help. I know if you list off, I need you to brush your teeth and comb your hair and put on your pants. If you do all that at one, they aren't going to remember to do all of them. So you just one step at a time to help them out. So strategies that can improve mental clarity and keep the body functioning correctly are exercising, eating healthy, challenging the mind, getting regular sleep, avoiding smoking, and limiting drinking. And then in this picture is my grandma, me, and my sister. That was a long time ago. I had to be like 4 or 6, I think. So that is a long time ago. So for I love this quote, or I don't even know if it was a quote, but so for our bodies to stay fit, a person must exercise. For the mind to stay sharp, a person must challenge it. I thought that was fun. So short and long-term consequences. Short-term symptoms, they can be delayed, but they're going to progress over time. And then long-term, they can have extreme memory loss, abilities to move also decline, so they might not be able to even get out of their chair. And with extreme memory loss, they might not remember their spouse or a child or a family member, I don't know, possibly not even their dog, I guess. But this is actually like my grandma. She has extreme memory loss. It's gotten really bad. She does not remember any of us. It's it's kind of funny. She remembers us. She knows who we are. She doesn't recognize us though, so she'll talk about us to our faces, like, "Oh, Katie had a good soccer game, blah blah blah, this, and they were over last night," thinking I'm a care provider, even though she doesn't know that I'm her actual niece. I don't know. I think it's kind of funny though. I don't know. So some people experience symptoms much faster than others. It literally just depends on the person. I've seen someone have dementia for a very long time and be fully mobile, and I've seen someone that has dementia will just hit a rough patch for a week, and then they will end up passing on. They'll go from fully moving around to being in a wheelchair because they can't do anything, and then in the bed and they can't even get out of bed. It's really sad. So this is my grandma. She is 78 now, turning 79 in November. And I think I don't know, I just really enjoyed researching this because she has it, and as a CNA I work with patients that have it, so I think that this topic could only be beneficial for me. Since I do work in the care place with dementia, I think people can look up the signs and symptoms of this, but when you're face to face in a real situation where someone's getting mad at you, or someone 1 second wants you to do this and then the next second they're freaking out at you because they don't know what you're doing, it's a lot to take on, and you kind of just have to adapt and learn what to do. Once an individual is diagnosed, there aren't any treatments that can cure it. There isn't for sure a prevention for this disease, but again, it's important to eat a healthy diet and exercise both the body and the mind regularly. This is a pathological condition that over time eventually will lead to death, which is just a very sad situation to see people decline at a slow rate or even a fast rate. It's really sad. And then this is my whole family. My grandma, she has 8 children: Tom, Rick, Dave, Dan, Kathy, Jim, Janine, and Suzanne. And then she has 19 nieces and nephews. All of her kids are married. And so this was us at last Christmas, and honestly, she did not even, we would talk with her there, and at Christmas we talked with her, but the only person she recognized was my grandpa. She didn't really understand, which was sad, but it happens. And we still go and visit her, and it's fine if she talks about us to us. As long as she remembers us, that's fine with me. But yes, this was my presentation on dementia. Thank you.